I am Michael Tassos. I am the administrator for Pegasus Surgery Center in Newport Beach, California. It is independently owned. We have two specialties currently: spine and pain management, primarily spine cases. We've been open for about 2 years right now, and actually we're very happy with HST. We use the practice management, and we also use the EMR. I really like the EMR a lot. My wife is a nurse who works at another center that has HST, and they haven't implemented it. And I've, to your question about how many years, or how long have I used it? I've used it since about 2007 with other facilities. And the decline in the number of charts that we have to audit is unimaginable. I mean, as most people know, if they've gone through this, it's a never-ending battle with chart audits, and we have eliminated it 100%. Nobody leaves without a signature, so I think that's the best part of HST right now is the EMR. I worked for another facility that had already had HST when I started there, so I was familiar with the product, and I actually ended up working for a company that did billing for quite a number of surgery centers, so I was able to see facilities across the United States, and again, I saw HST in most of the facilities, and it just made it a lot easier to go in and know exactly how to run a report, how to run the parameters for billing and collections, and now the latest is the EMR. Can't say enough good things about it. I think centers that aren't using it are really missing the boat. So most facilities that use paper charts have an enormous number of missed items for anesthesia, nursing, the doctor's notes. It's a never-ending battle to try to get everybody to complete everything. And now with the checklist system that you have, even in you can't move on in the section until everything is completed. So it flags the problems immediately, and you can immediately reconcile when anesthesia record doesn't match the pre-op or post-op notes, or the doctor's notes, the diagnosis doesn't match what the pre-op instructions were or post-op instructions. It's a great tool. I looked at others. I didn't find anything, to be honest with you, that was comparable. And it was something that I was very familiar with. So to me, it was a no-brainer to just go with HST. Yeah, basic things of just keeping track of the charts. Most systems have basic billing and collections, but it was easy. We have an outsourced billing company that was familiar with HST, so as soon as we mentioned it, they were ready to go and just able to log into our system. So that was a major plus. Also, for our facility, we took a number of people that had worked on Epic, which is a hospital-based system, and they were not familiar with it, and it was very easy for them to come over and understand and get familiar with the system pretty quickly. And then what I also like is just the ticklers, being able to track, when is somebody's ACLS going to expire, when's that nursing license going to expire, so that we can sit there and catch these things before they expire, and hopefully get the information before the expiration dates. I do like, as I say, the EMR is number one, because it just flags so many things and eliminates so much paperwork. I think number two is the ability that I can log in and know that it's on your server and not mine now. We haven't had any problems since we've implemented it, so that I can go in the morning and see the cases for the day, and then do an analysis on what we expect we're going to get, what's our revenue going to be on this case, what are implant costs, who's there for the day, and then immediately get this information over to our billing company. And third is just the compliance, that I'm not missing dates like ACLS or BLS dates or nursing or fluoroscopy license, that I can get this information very quickly. Things like blood loss, estimated blood loss are important. Our actual stay times, what's the recovery time? We actually reduced our recovery time significantly when we started tracking it, and the minute features within HST really allow you to dissect what's going on. Is it somebody that's is it a recovery issue? Is it a pre-op issue? Is it OR issue? Is it turnover of the room issue? You can really take those times and dissect what's going on in the day, which is extremely helpful. And obviously, a lot of dollars involved in analyzing, how to be more efficient. I don't know that I can quantify it for you, but I can tell you anecdotally that we don't have staff sitting around after the fact going through the charts and then going through the charts and going through the charts another day. I mean, I have been at other centers where you literally could, it's one or two FTEs that are sitting there and trying to go back and trying to find the doctor's signature or the anesthesiologist's signature or the nurse's signature on this stuff. The savings is amazing. The other thing is, again, efficiency of time. We were able to cut our recovery time literally in half by showing the doctors that making simple suggestions on, how much time do you want? Because you've got people sitting in the recovery for 2 hours. Can we analyze? Can we let them go home earlier? Well, that's all this. There's a cost savings to getting them out the door and getting the staff, home and with their families. It was actually very good. We had several people from the HST team that were the implementation specialists, and they guided our staff very, very well. We really, I put in a different EMR system in an orthopedic group years ago, and it was an absolute disaster because nobody really followed, didn't understand it. Even by the point where we got the implementation, they didn't know what to do. So we were very pleased that it went pretty smoothly. It's been very good. I can't really recall any instances where we didn't get a response very quickly. I guess that's the only, sometimes there have been there's some little delays getting somebody to respond within, I know it's for us the moment that there's a problem, it's a crisis, we want an answer immediately. And usually somebody gets back to us within about 15 or 20 minutes.